internet viewers, it's Danielle Conway, a physical therapist here at Breakthrough, and I'm here to talk to you about low back pain. So if you ever wake up in the morning and you feel a little stiff, or maybe after sitting for a long period of time and it feels like it takes you a while to stand up straight, that can sometimes be QL tightness. The QL stands for the quadratus lumborum, and it goes across your low back. Although this muscle is usually not the cause, it's usually a symptom. There are a few key tests that you can do at home to check your postural alignment so we can address that lower back pain that you might have. And with this, I'll be needing a special helper, Joan. The first test that we can do tests your postural alignment. Ideally, you should find a blank wall that you can stand up against. You're going to want to get your feet and heels up against the wall. Then you're going to want to get your buttocks or SI region up against the wall. Next is that mid-back or bra strap line area. You're going to externally rotate the shoulders so the palms are facing away. Get those shoulders against the wall and the back of the head against the wall. This creates that line that you want of everything kind of being in one straight line from the head down to the heels. You can take a stick or a pen and place it in that mid-back spot because that tends to be the place that people aren't able to get against the wall. If you're able to tuck that mid-back so it's flat against the wall, when you let go of the stick, that stick should be able to stay. If you aren't able to and that mid-back is away from the wall, then that stick will fall and you failed. The second exercise we're going to do for low back pain testing is going to have to do with pelvic tilts. So what you're going to do is you're going to face the side, and if you have a mirror that you can look into, that's ideal. But you're first going to tip your hips forward into an anterior pelvic tilt where you get an increase in that lordosis of the low back. Then you're going to come back to neutral and then tip backwards into a posterior pelvic tilt where you get kind of rounding out of the spine. So you want to be able to tip into that forward and backward in a pain-free range. The third test that we're going to be doing is going to be testing a hip hinge. We do a hip hinge like 1,000,000 times a day, so you really want to be able to know how the correct way to do it. So the easiest way you can do it is putting a stick across your low back. You want it to be on the back of the head, kind of on that bra strap region we talked about, and the top of that sacrum. You want to then be able to, with straight legs, bend forward and hinge just at the hips so that pole is still touching in all of those areas. If the pole comes up at the base of your sacrum when you bend farther down, that can be from a number of different reasons, but usually it can be from that tight hamstring. The fourth test that we want to do tests that hamstring length that we were just talking about. The easiest way is if you find a door frame that you can put one leg up and one leg through. You want to bring yourself all the way so your buttocks is up against the wall, and ideally your leg and all the way up to your foot. If all this is touching, then that means you have good hamstring length. If you're unable to get fully up, or if that knee is slightly bent, then you probably need to stretch out those hamstrings. The fifth test that you can do at home is going to be looking more at glute strength. So get yourself up on a little step. You're going to leave one foot on the step, kick that other leg out, and you're going to do a single leg step down. Ideally, you want to look to make sure that your hips are staying level. So when you come down, you don't want one hip dropping because that shows some glute weakness. And you also want to pay attention to that knee. That knee should try and stay over that second toe and track straight forward and not jump in and give you a knee valgus or jump out too much and do something else crazy. The sixth test that you can do looks at scapular control. So you're going to want to face sideways, push one arm out straight. This is called a serratus punch. So you're going to punch that arm away from you and bring it back. Ideally, you're going to want to use these lower muscles and not these upper trap up here. So you don't want that shoulder coming up at all. That's a no-no. You want it coming straight back and down, keeping that elbow straight. Ideally, you also want to be in that proper posture position and getting those upper abs on and turned on and not sitting there with arms hunched over. So that's a wrap on our 6 tests that you can do at home to check your postural control and that low back pain that you might be getting. If you know anybody with low back pain or you might have it yourself, feel free to like and share this video and get the word out. Stay tuned for part 2 where we're going to be going over some exercises to help you treat that, or just come on into Breakthrough and we'll help you out.